Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be performing the skill colostomy care. For this video, I have my colostomy bag and my barrier adhesive, and they've already been applied. I have my hand sanitizer I'm going to be using for hand hygiene. I have my barrier cream. I have my measuring device, and I have 2 washcloths that I'm going to be using to clean the stoma and my trash bag. So I'm going to enter the patient's room, knock, knock, knock. I'm going to close the door behind me for privacy. I'm going to introduce myself to my patient. I'm going to have the patient identify himself, and I'm going to explain the procedure to the patient and get the patient's consent. So knock, 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 close the door behind me. Hi, good morning, Mr. Mills. My name is Terika, and today I'm going to be your nurse. I'm going to perform hand hygiene. So, Mr. Mills, the doctor has ordered that I change your colostomy bag. Is that okay with you? Okay, can I see your wristband? Can you confirm your name and date of birth? Okay, so Mr. Mills has correctly identified himself using 2 identifiers, and he has given his consent. So now I'm going to go ahead and I'm going to proceed. I've already cleaned my hand, so now I'm going to apply my gloves. Alright, so Mr. Mills, what I'm going to do, I'm going to remove this old bag that you have here, and then I'm going to clean around the area, and then just do a little inspection to make sure that the skin is intact, the stoma is intact, and then I'm going to apply a new one, okay? Alright, so first I'm going to remove the bag. Okay, so after I remove the bag, I would empty the content. I would first have to open the seal in the bottom, and then I would empty the content in the designated area, whether it's a toilet, and I would measure if indicated. I would also examine the stool to see if there's any blood or any mucus, because all we want in this bag is just stool. So we're gonna examine it to make sure the content is just stool, and then after I've emptied it, I would discard it in the trash, okay? Alright, but for the purpose of this video, I only have one, so I'm going to keep it to do my reapplication. Alright, so after I have removed the bag, I would go ahead and I would remove the barrier ring, the adhesive barrier ring from the stoma, and I have to remove it gently. So I'm going to pull around it slowly, and I'm going to pull it towards the stoma so as to prevent any pulling from the side. I'm going to remove it slowly to make sure I do not irritate the skin. Alright, so I have removed it, and then similarly like I did with the bag, I would dispose of this in the trash, but for the purpose of this video, I have to keep it for reapplication. Okay, so after I have removed the bag and the barrier cleanser, now I'm going to go ahead and I'm going to clean the area. I'm going to clean the area with water and any approved solution. So it's warm water and an approved solution. I'm going to clean around it, and then I could fold it. If there's any feces or anything on the stoma, I could get a clean area, and I could also clean the stoma. Okay, after I've cleaned it, I'm going to discard the washcloth in the trash, okay? So after I've cleaned the area, I'm going to assess the skin for any, just assess the tissue integrity of the skin. Check to see if there's any breakdown in the skin, any discoloration, any swelling, any warmth. The skin looks pretty much okay, and the stoma itself has a nice beefy red color, and that's exactly what we want. If there was any discoloration in the stoma, if it was blue or purple, we would have to notify the provider immediately, okay? So now that the stoma looks good, I'm gonna go ahead and I'm gonna measure the stoma, and I'm gonna go ahead and measure the stoma with the provided measuring device. So all right, so for this measurement I have measured 35 milliliter, and when you're measuring it, you want to ensure that it's not measured too close to the stoma, or you don't want it too far because you don't want any leakage. You don't want it too close because you don't want anything that's like rubbing on it for any skin irritation or anything. So this one is measured at 35 milliliter. So millimeter, sorry. So I'm gonna take the same measuring guide, and I'm gonna measure the I'm gonna try to get the same measurement on the adhesive ring to make sure I have the exact measurement. And then what I do, I would trace around the circle, and then I would use a scissor and cut it out, so I have the exact measurement on the securing device. So as you can see, it's already pre-cut. So now what I'm gonna do, I'm gonna use my second washcloth, and I'm gonna dry around the area. I'm gonna pat dry, and I have to make sure that it's completely dry before I attach the faceplate. So now I'm gonna discard this. So I'm gonna use my skin prep and my skin protectant, and I'm gonna put it around it, so as to protect the skin, so the adhesive doesn't irritate it. I'm gonna apply my skin prep, and I'm gonna allow it to dry completely before I attach the faceplate. All right, so now that the required amount of time has passed, I'm gonna go ahead and I'm gonna apply my faceplate, my adhesive faceplate. I'm gonna apply it, and I'm gonna ensure that it's completely sealed because we don't want any leakage. So I'm gonna take my hand and I seal it all around so as to prevent leakage. All right, so now that this is sealed, I'm gonna attach my pouch or my bag to the faceplate. Okay, I'm gonna ensure that it clicks. You hear that clicking sound, that way you know it's sealed. And I'm gonna I could just inspect it to make sure it's on securely and it's sealed all around. All right, so now that it's sealed, I'm gonna ensure that the pouch is closed. So what I'll do, I'll go ahead and I roll this part up because we don't want any leakage. And now that I've rolled it up, I'm gonna close it here. Okay, so the bag, and if the patient could help, what you could do, you could have the patient take his hand and just hold it on it for a little while, because the body heat will assist in sealing the bag. So just have them hold it there for a little while. If they can do it, then you could do it for them. Just keep your hand there for a little while, and that's for just a little bit of extra sealage of the adhesive. All right, now that I've done that, I am gonna so the bag is applied, it is sealed, and now I'm gonna go ahead and I'm gonna remove my glove. Okay, and then I'm going to perform hand hygiene. Mr. Mills, how are you feeling? Are you comfortable? Do you want me to reposition you? Okay, so Mr. Mills has verbalized that he's okay. So now I'm going to go ahead and I'm going to document my procedures. And if there were any concerns, I would go ahead and notify the provider. So I have already cleaned my hands, so I'm going to leave the patient's room and then I'm going to close the door behind me for privacy.